All right, welcome back, everybody, to the morning show with Bob Hoffmaster on News Talk 1450 KFIZ in Fond du Lac. I'm very happy to welcome in my next guest. His name is Dr. Mark Veth, and he is with OptiVision Eye Care, and they have locations all over our part of the state, but also, of course, here in Fond du Lac at 437 North Pioneer Road. And we're going to talk a little bit about, kind of give you an overview of OptiVision Eye Care, as well as get into some more specifics here. And, Doctor, how are you?
Pretty good.
Thanks for being here. You told me off the air that you have a history in radio.
Yeah, a very limited history. Last time I was in a radio station was probably when I was 12 years old, which is going back 22 years. And my dad and I would go down in Chicago and go smelt fishing, and it was a big deal back then. And afterwards, about 1 in the morning, we'd go to the WGN, which you're familiar with WGN.
WGN
right?
Radio, of course, 720. Yes.
Yeah, I think it gets up here.
That's what it gets everywhere.
Yeah, that's why. So we'd go there and beer batter the smelt and fry them up and take them up to Eddie Schwartz, who was the late night host on WGN at that point. And it's kind of coincidental. Eddie Schwartz died last night, which
that's sad. And I was telling you, I grew up listening to Eddie Schwartz with the transistor radio underneath my pillow, and I guarantee you there are a lot of listeners. I did not know he passed away last night. Yeah,
I got the phone call actually this morning on the way up. My dad always calls me like at the worst times you can call a guy. 6:45 in the morning, you know. Come on, Dad.
You're thinking probably the worst thing. 6:45. Right. My gosh, what happened? And not to belittle the passing of Eddie Schwartz, but that's you know, I don't know if that's worthy of a 6:45 call.
No. Well, he was a nice guy.
So, and for anyone that doesn't understand, Eddie Schwartz was a rather large man, so I imagine he could eat a lot of smelt.
Yeah. Well, he loved it, and we got a number of Cubs tickets from it. It was.
I don't know. Would it be as easy? Could you get Cub ticket for smelt right now? I think it's a hotter ticket, perhaps.
It might be. It might be.
Doctor, and we're talking to Dr. Mark Veth from OptiVision Eye Care, and enough of the smelt fishing. We need to get down to basics here and let you explain a bit about OptiVision Eye Care. If you don't mind, if you could maybe start off by just giving us a little overview. I have seen it described in one of my lists here as the premier eye care, the premier eye care group in this part of the state. Explain what that means.
Well, we do just about anything with the eye. Diagnose, treat disease. We do LASIK surgery. We do cataract surgery. We treat glaucoma. We treat, diabetic retinopathy. I think when you come to us, what you're getting more than, just if you just go get a regular eye check is you get a more comprehensive eye exam. It's not just the eye that I take into account, or the other doctors. When we do an exam, I'm looking at the whole person. So, and that's what I think when you get when you talk about a complete eye exam, a comprehensive eye exam. You're looking not just as a set of eyes. You're looking at the person as a whole individual.
And why does that make a difference in your mind?
Well, if you can understand what a person needs their vision for what they do, you can get a better read on what it is to make them happy, what it is to make them, when you're talking why should somebody get an eye exam? Yeah,
why a regular eye exam?
I was thinking on this earlier today, and as I had my coffee, I came up with, when you're young and you have your vision, you want to enhance it, you want to maximize it, and then that's a lot of times you don't know that you're not seeing you might not be seeing as well as you're seeing. You might not be using your vision as well as you can be using it. That's one reason to come get an eye exam. Mm-hmm. The second is as you get older and you have reasons to, you want to preserve that vision. Mm-hmm. So I look at it as kind of when you're younger and you think, I don't need an eye exam. Well, you might not be getting all you can out of your vision, and then as you're older, you need to preserve that vision.
I will admit I absolutely have been very guilty of not having that regular eye exam, and from the time I was a kid and just was squinting in a classroom, and eventually a teacher told my parents, and I got glasses, to recent times where I guess I don't really realize, you don't necessarily realize that you're having to strain, perhaps, to watch a TV or to read a sign as you're driving.
Right.
You don't really realize it, right?
Right.
And if you don't get that regular, when I got that exam, I was absolutely blown away as to how bad my eyes had become in the 6, 7, 8 years it had been since I'd had an exam.
Yeah, children don't know how they're seeing because they only know what they know.
Mm-hmm.
So sometimes it takes a parent to be observant or a teacher to be observant to pick out that a kid may be struggling, and a lot of times kids will be, teachers will worry about them. They'll say that kid's not functioning at the right level. A lot of times that's because that child's not seeing right. He can't read as well because he's struggling to actually see the word and focus on the word.
Now, we have a lot of things we want to get to, but I just want to ask you a question here related to the children's eyesight. Is there any issue with all the computer usage of kids today? I know when I was a kid, there used to always be I'm thinking probably a wives' tale, don't watch so much TV, it's going to ruin your eyes. Now, I don't know if that's true or not, but I'm guessing it might not be. I don't know, but are there issues? Are there issues with all the computer games and use that kids have today that could affect their eyesight, or not at all?
It's hard to answer that as a yes or no.
Okay.
The computer's at a level of vision that it's more intermediate. It's not quite near. It's not quite far.
Mm-hmm.
There's a little bit of strain that goes on when you're on a computer. I'd hate to say that it's going to make your eyes go bad. I don't want to
scare people.
But it's the computer. For kids, a lot of times, and it's great for visual functions. I know that Nintendo Wii has a game that's actually out there to help with visual training, and a lot of athletes actually use computers and issues like and things like that to hone in their tracking and skills. But a lot of times on the same regard, a lot of times when you're on a computer, you're concentrating, you're not blinking, your eyes dry out, you get a little bit of strain. When you get into your 40s and your focusing is not quite where it was when you're younger, if you're focusing and straining up close all day, that leads to strain at a distance.
Oh, wow.
So, there's terms that are out there. Computer vision syndrome. I don't know who came up with that, but it's true. Sometimes being on the computer a lot all day, it's like sometimes I tell patients that are on a computer all day, and they say, my vision's just not sharp, and I have all. If you're on a computer all day, it's almost like a dishwasher saying, I want really, really soft, nice hands.
It's just not. It's not conducive.
Right.
One doesn't go with the other.
That's not to say that there aren't things that you can do, and we can help to solve with those issues. I mean, there's simple. If your eyes are feeling dry, we can recommend some drops to use. If you're actually struggling to see, there's different lenses that you can use. There's actually a really nice new lens out there. It's not new, but it's not prescribed a lot, but it's great. It's called the office lens. It's for those people that are on a computer all day, where you can actually see instead of it being distance right where you're seeing through the center, it's actually intermediate. So it's great for a computer. And then you can on the bottom it has the reading, so it allows for a lot more comfortable level of vision.
Oh, that's something that some people might be interested in right there, and that's something you offer.
Sure.
At OptiVision.
Yeah.
We're talking with Dr. Mark Veth with OptiVision Eye Care, located in a number of different areas, another number of different places in our area, but in Fond du Lac, they are at 437 North Pioneer Road. You talk a bit about all the different aspects you cover at OptiVision. Where do you want to start? We talked a bit about the routine eye care. What about some of those words that we hear and maybe don't always understand, like the glaucoma?
Okay. Glaucoma, everybody thinks it's just the thing that I get my eyes puffed for with a puff of air.
Yes. Yeah.
And just to let everybody know out there, I don't do the puff of air. So
Really?
I do a different way. It's called Goldman tonometry. It's actually the gold standard in how you actually check for pressures. It's a direct measurement, and actually it's a lot less annoying than the air puff.
Really?
Yes.
What can you? Because I must say I have been targeted as a complete wimp because I really do not like that air puff thing.
Yeah, not many people do, and I think it's just because it's.
But
It doesn't hurt.
If
It's just,
my wife is listening, can you say that again? Not a lot of people do like that.
no.
I get made fun of a lot about
Yeah,
that.
don't sweat it.